In this video, we will discuss about mandibular nerve and otic ganglion. The mandibular nerve is the largest mixed branch of the trigeminal nerve. It is a nerve of first branchial arch and supplies the structure derived from the first branchial arch. It is related with two ganglion, the otic ganglion as well as submandibular ganglion. Mandibular nerve begins in the middle cranial fossa by a large sensory root and a small motor root. The sensory root arises from the lateral part of this trigeminal ganglion, whereas motor root lies deep to it. Both the sensory and motor root passes through the foramen ovale. They unite with each other just below the foramen ovale and form the main trunk of the mandibular nerve. This main trunk lies in the infratemporal fossa. After a short course downwards, it soon divides into a small anterior trunk and a large posterior trunk. From the main trunk of the mandibular nerve, there are two branches, a meningeal branch and nerve to medial pterygoid muscle. From the anterior trunk, there is one sensory branch known as buccal nerve and the remaining motor branches, which are mesatric, temporal nerves and nerve to lateral pterygoid muscle. And from the posterior trunk, there are three branches, these auriculotemporal nerve, lingual nerve and inferior alveolar nerve. The meningeal branch enters the skull through foramen spinosum and supplies dura mater of middle cranial fossa. The nerve to medial pterygoid supplies the medial pterygoid muscle from its deep surface. The nerve to medial pterygoid also gives the motor root to the otic ganglion, which passes through the ganglion without relay and supplies the tensor tympani and tensor valli palatini muscles. Buccal nerve is the only sensory branch from the anterior trunk. It supplies skin and mucous membrane related to the buccinator muscle as well as labial aspect of the gums of molar and premolar tooth. The mesatric branches emerge through the upper border of the lateral pterygoid muscle. They passes through the mandibular notch along with the mesatric vessels and supply the masseter muscle from its deep surface. Apart from masseter, it also supplies temporomandibular joint. There are two deep temporal nerves from the anterior trunk of mandibular nerve. Both the deep temporal nerves supply the temporalis muscle from its deep surface. The nerve to lateral pterygoid also enters the muscle through its deep surface. The auriculotemporal nerve arises by two roots from the posterior trunk. Both the root goes backward and circle the middle meningeal artery, unite to form a single nerve, which first goes backward above the maxillary artery and then it turns upwards behind the neck of mandible and run behind the superficial temporal vessels. The auricular part of the nerve supplies the skin of tragus, upper part of pinna, external auditory meatus and tympanic membrane. The temporal part of the nerve supplies the skin of temple, temporomandibular joint as well as secretomotor and sensory fibers to the parotid gland. The lingual nerve is one of the terminal branch of the posterior trunk of mandibular nerve. It is sensory for the anterior 2/3 aspect of the tongue as well as the floor of mouth. But the fibers of chorda tympani nerve which carries taste sensation from the entire two-thirds of the tongue, as well as it gives secretomotor fibers to the submandibular and sublingual salivary gland are also distributed through the lingual nerve. During its course, lingual nerve starts 1 cm below the skull. About 2 cm below the skull, it is joined by this coda tympani nerve. Then it comes in contact with the medial aspect of the third molar tooth of mandible, and finally it runs on the hyoglossus and genioglossus muscle to reach the tongue. Finally, the nerve winds around the submandibular duct and divides into its terminal branches. The inferior alveolar nerve is the larger terminal branch of the posterior division of mandibular nerve. It runs vertically downwards, lateral to this medial pterygoid muscle as well as phenomandibular ligament. It then enters the mandibular foramen, runs into the mandibular canal along with the inferior alveolar artery. The inferior alveolar nerve gives a mylohyoid branch, a mental branch, and branches to the lower teeth and gums. Mylohyoid branch or nerve to mylohyoid arises just before the inferior alveolar nerve enters the mandibular canal. It carries all the motor fibers of the nerve and supplies mylohyoid muscle as well as anterior belly of the digastric muscle. This branch runs in the mylohyoid groove and pierces sphenomandibular ligament. While running into the mandibular canal, it gives branches to the lower teeth and gum. Its mental branch emerges out through the mental foramen, supplies the skin of chin, skin and mucous membrane of the lower lip, and gives an incisive branch, which supplies labial aspect of the gum of the incisor and canine tooth. We will now discuss the applied aspect of the mandibular nerve. The motor part of the mandibular nerve is tested by asking the patient to clench his or her teeth and same time feeling the contracted masseter and temporalis muscle. If the masseter of one side is paralyzed, the jaw will deviate to opposite side on opening the mouth. Activity of the pterygoid muscles are tested by asking the patient to move the chin from side to side. In case of carcinoma of tongue, the pain radiates to the ear as well as in the temporal fossa because both the lingual and auriculotemporal nerve are branches from the posterior division of mandibular nerve. To relieve such pain, lingual nerve can be divided where it comes in contact with the mandible, that is below and behind the third molar tooth. To treat the mandibular neuralgia, the sensory division of the mandibular nerve is divided behind the trigeminal ganglion. During this procedure, the ophthalmic fibers are spared to preserve the corneal reflex. The lingual nerve comes in contact with the mandible medially below and behind the third molar tooth. So during the extraction of the wisdom tooth or third molar tooth, care should be taken to avoid injury to the lingual nerve as it carries the general sensations from the anterior two-thirds of the tongue. During the extraction of the mandibular tooth, the inferior alveolar nerve needs to be anesthetized. The drug is given into the inferior alveolar nerve before the nerve enters the mandibular canal. As the inferior alveolar nerve traverses the mandibular canal, it can get damaged during the fracture of mandible. The injury can be assessed by testing the sensation over the chin. During the extraction of third molar tooth, the buccal nerve may get involved by the local anesthetic agent which causes temporary numbness over the cheek. Having learned the mandibular nerve, we will now discuss about otic ganglion. Otic ganglion is a peripheral parasympathetic ganglion which supplies secretomotor fibers to the parotid gland. Topographically, it is related to the mandibular nerve, but functionally it is a part of glossopharyngeal nerve. It is about 2 to 3 mm size. Its location is in the infratemporal fossa just below the foramen ovale. In the infratemporal fossa, it lies medial to the mandibular nerve and lateral to this tensor valley palatini muscle. The connections of otic ganglion are secretomotor or the parasympathetic root, sympathetic root, sensory root, and other fibers. The preganglionic fibers of the secretomotor or the parasympathetic root arises from the inferior salivatory nucleus. After arising from it, it goes into the glossopharyngeal nerve, its tympanic branch, tympanic plexus, lesser petrosal nerve, which relays into the otic ganglion. Postganglionic fibers arising from the otic ganglion will join with the auriculotemporal nerve and supply the secretomotor fibers to the parotid gland. The sympathetic root is derived from the plexus over middle meningeal artery. It contains postganglionic fibers arising from superior cervical ganglion. This fiber passes through the otic ganglion without relay and reaches to the parotid gland via auriculotemporal nerve. These fibers are vasomotor in nature. The sensory root comes from the auriculotemporal nerve and it is sensory for the parotid gland. The other fibers related to the otic ganglion are nerve to medial pterygoid and cauda tympani nerve. This nerve to medial pterygoid gives the motor route to the otic ganglion, which passes through the ganglion without relay and supplies tensor valley palatini as well as tensor tympani muscles. The cauda tympani nerve is connected to the otic ganglion as well as nerve to pterygoid canal. These connections provide alternate route for the taste sensation from the anterior 2/3 of the tongue.